Welcome all. I am Dr. VINEET from the Department of Consultative Dentistry and Endodontics, Annoor Dental College. And today I will be dealing with endodontic emergencies. You may all be knowing what an emergency is. Emergency is a sudden, urgent, usually unforeseen occurrence of a situation which requires an immediate action. Emergencies can happen in all spheres of life. We can take the present COVID pandemic as an example, which affected the lives of millions of people all around the world. However, we should know how to manage such an emergency and take control over the situation. Life-threatening emergencies can occur in the practice of dentistry as well. Endodontic emergencies are circumstances associated primarily with pain and/or swelling that require an immediate diagnosis and prompt treatment. So, in an endodontic emergency, the patient would be in a state of continuous pain that may be sometimes accompanied by swelling also. The role of dental practitioner is to provide an immediate management to relieve the suffering of the patient. In this regard, there are two terminologies that you should know. Emergency is a condition which requires unscheduled visit with diagnosis and treatment at that same time. Urgency, it can be considered as a less severe problem in which next visit may be scheduled for mutual convenience of both patient as well as the clinician. An endodontic emergency is defined as pain and/or swelling caused by inflammation or infection of the pulp and/or periauricular tissues necessitating an emergency visit to the dentist for immediate treatment. So we can tell that an endodontic emergency is a stressful situation for both the patient as well as the clinician. However, the dentist, being a professional, should have adequate knowledge to quickly diagnose the condition correctly and provide a speedy and effective relief. Now we will discuss on what all are the conditions that present as an endodontic emergency. These conditions are broadly classified based on the stage of endodontic treatment as before treatment or pre-treatment emergencies, during treatment or intra-treatment emergencies, after treatment or post-treatment emergencies. The first one, that is the before treatment or pre-treatment emergencies, is further subclassified into endodontic emergency presenting with pain and or swelling and traumatic injuries. So the conditions that present with pain and swelling include cracked tooth syndrome, symptomatic reversible pulpitis, symptomatic irreversible pulpitis, symptomatic apical periodontitis, acute exacerbation of asymptomatic apical periodontitis, that is phoenix abscess, acute alveolar abscess, and cellulitis. The traumatic injuries that present as endodontic emergencies include crown root fractures, luxation injuries, and tooth avulsion. During treatment or intra-treatment emergencies include forked tooth and endodontic flare-ups. After treatment or post-treatment endodontic emergencies include post-obturation pain and vertical root fracture. Now we can discuss about the various pre-treatment endodontic emergencies presenting with pain and or swelling. In this, the first condition is cracked tooth syndrome. Cracked tooth syndrome denotes an incomplete fracture of a tooth with a vital pulp. The fracture line usually passes through enamel, dentine, and often involves the pulp. Coming to the prevalence of cracked tooth syndrome, molars of older individuals most frequently present with cracked tooth syndrome. Most cases occur in teeth with an opposing plunger cusp that occludes centrically against a marginal ridge. Mandibular molars are most commonly affected, followed by maxillary molars and maxillary premolars. Coming to the clinical features, patient usually complains of mild to excruciating pain, which may be due to an incomplete fracture of enamel and dentine. However, when the fracture involves the pulp chamber, pain becomes severe, and at this stage, it becomes a true endodontic emergency. Close examination of the crown of the tooth may disclose an enamel crack. Pain upon release of pressure is a strong indication of the presence of a cracked tooth. There are various aids for diagnosis of cracked tooth syndrome. First one is transillumination using fiber optic light. In this, fiber optic light is used to transilluminate a fracture line. In normal healthy tooth, when you apply the light source, light transfers from one side to the other, as you can see in the figure. However, if there is a crack in the tooth, light will not be transmitted to the other side. Magnifying loupes can be used for enhanced visual inspection of crack. Dyes like methylene blue are valuable aid to stain the fracture line and detect it. Bite test using a tooth sleuth. Now, what is a tooth sleuth? As you can see in the figure, it is a small pyramid-shaped plastic bite block. A small concavity at the apex of the pyramid to accommodate cusp of the tooth. In bite test, when the patient bites down, the fracture segments may separate and the pain may be reproduced on release of the biting pressure, which is a highly suggestive of a cracked tooth. Coming to the management of a cracked tooth, immediate treatment is covering the exposed dentine with a sedative cement and cementing a stainless steel band. Stainless steel band is used for immobilizing the fracture fragment. This should be immediately followed by selective grinding. This is to relieve the occlusion by grinding the cusps of the tooth. If the pulp is exposed, pulpectomy should be performed. Definite treatment requires a full occlusal coverage for cusp protection. Now let us discuss the other pre-treatment endodontic emergencies briefly. Symptomatic reversible pulpitis. In this, there will be mild to moderate pulpal inflammation caused by noxious stimuli, and pulp is capable of returning to normal once the stimuli are removed. The management includes removal of the noxious stimuli and restoration if required. Periodic vitality testing to assess the status of pulp. Symptomatic irreversible pulpitis is symptomatic pulpal inflammation, and pulp is incapable of healing. Symptomatic apical periodontitis, a painful periodontal inflammation due to trauma, irritation, or root canal infection. Clinical symptoms include painful response to biting and percussion. Management include pulpectomy and pharmacological management of pain using analgesics and anti-inflammatory drugs. Venous sepsis, it is acute inflammatory reaction superimposed on an existing asymptomatic apical periodontitis. Acute alveolar abscess, rapid inflammatory reaction to pulpal infection and necrosis, spontaneous pain, tenderness of the tooth to pressure, pus formation, and eventual swelling of associated tissues. Cellulitis, it is symptomatic edematous inflammatory process associated with invasive microorganisms that spread diffusely throughout the connective tissues and facial planes. The management includes pharmacological management of pain and swelling along with occlusal adjustment, access opening, incision and drainage, needle aspiration, antibiotics, refination, and decompression. Next, let us discuss upon the traumatic injuries that may present as endodontic emergency. First, it is crown fracture. There are two types of crown fracture: uncomplicated crown fracture and complicated crown fracture. Uncomplicated crown fracture involves enamel and dentin. It is like a green stick fracture, where the fracture segments does not shear off under pressure. So the management include a stainless steel band is cemented around the tooth to stabilize the fracture segments, and occlusion is relieved to eliminate the pain, and the pulp status is evaluated at regular visits. Complicated crown fracture involves enamel, dentin, and pulp. Management depends on two factors, that is, first one is degree of pulp exposure, whether it is pinpoint exposure or is it total unroofing of the coronal pulp. Second factor is maturity of the pulp, whether it is immature, that is open apex case, or mature with closed apex. How to know it? Radiographic examination of tooth is important in this scenario. So, based on the degree of pulp exposure and the stage of root development, the following treatment options are there. First one is pulp capping. It is indicated where there is pinpoint exposure of the pulp without possible contamination. In this, the pulpal hemorrhage is controlled and a pulp capping agent like calcium hydroxide, MTA, or biodentine is placed over the exposed pulp and the tooth is restored. Second is pulpotomy. Pulpotomy is indicated in immature tooth with open apex. Here, only the infected coronal pulp is removed without removing the radicular pulp. The sec type pulpotomy is a modification of pulpotomy technique where only the contaminated part of the coronal pulp is removed without removing the entire coronal pulp. Hence, it is also called as partial pulpotomy technique. After the pulpotomy, a pulp capping material such as calcium hydroxide, MTA, or biodentine is placed over the remaining pulp stem and the tooth is restored. This helps in the normal physiological root development, that is, it promotes apexogenesis. This pulpotomy procedure is performed with the assumption that the radicular pulp is healthy. However, if the coronal as well as radicular pulp is infected in an immature tooth, we may have to proceed with apexification procedure using calcium hydroxide or MTA to form an apical barrier. Pulpectomy is indicated in mature tooth with closed apex, that is, with complete root development. In pulpectomy, the entire pulp, including the coronal as well as the radicular pulp, is removed. The canal is then disinfected with root canal irrigants and black canal medicaments and obturated three-dimensionally. Follow-up is essential in these conditions. Acceptable results of evaluation following pulpotomy should be all of the following. That is, there should not be any clinical signs or symptoms, no evidence of periradicular pathologies, no evidence of internal or external resorption, evidence of continued root formation. Next is root fracture. Here, fracture involves the root only, that is, cementum, dentin, and pulp, and it accounts for approximately 2% of all dental injuries. Coming to the management of root fracture, and the management depends on the location, direction of fracture. So based on the location, there are three types of root fracture, that is cervical thread fracture, middle thread fracture, and apical thread fracture. So the management of cervical thread fracture includes reattachment of the segment if it is displaced, printing to stabilize the fragment. If the segment is lost, post and core is done. Middle thread fracture, printing is done for stabilization and strategic management of fracture segment. Apical thread fracture, mostly it is left untreated.